welcome to this Managing Pain Mastermind. I'm Steve Costello, and I will introduce my colleague Leo in a few moments. So, I was diagnosed with a chronic pain condition back in 1999 following an accident. It took a while, but after some time, the diagnosis was changed to fibromyalgia. And at the time, I had a great career, high flying, you could say. And then suddenly I didn't, because my employer decided that I was no longer fit for work. So a lot of dark days followed, a lot of painful days. Anybody with fibromyalgia knows what I mean by painful days, right? And so I'm retired. I'm taking a lot of medication, seeing a lot of doctors. The medication was addictive. Was it really helping? No, it wasn't really helping. I thought it was at the time, but that wasn't the case. And after a while, I started to find ways to take back control and find my new normal. So here I am, my new normal. You'll learn more about me in other events and within the group. But now, over to Leo.
Hi, I'm Leo Fire. I am a clinical psychologist from Russia. I'm a neuropsychologist and a psychotherapist as well. And I do my job for more than 20 years. I started my career as a psychologist in perinatal services, and a lot of issues were concerning pain in labor, but not just that. Is also much about general burden that pregnant women bear, emotional distress that they face and their families do. And it brought me to the idea that a lot of difficulties are connected together. I mean, both physical and mental and the environmental, because a lot of things are connected to the surroundings of the person. People who surround her natural environment, her food, her social surroundings. And this brought me to the idea of a biopsychosocial approach in my therapeutic practice. My personal experience with pain, I think, is more of average. I do have some back pains or joint pains, but I see how I apply my knowledge and help myself. The trick is that I come from a family with a very long history of suffering, physical suffering. Different kinds of pains or diagnosis or some disease is always the topic at our family dinners, while calling each other, calling my mom. And the trickiest thing is that all of my relatives, both my parents and my grandmothers and my grandfather, are physicians. They dedicated their lives to fighting everybody else's pain, but failed to fight their own. And being a first psychologist in such a long medical family, such a long history of practical physicians, I do see some extra ways along with the traditional medical path. So I am eager to share my experience, both personal and professional, and I hope it will be of help.
Thanks, Leo. I'll just add a little bit I mentioned having a great career, but what I didn't mention is that I too am a psychologist. Not too much detail to share right now, but my main interest is in relation to cognition, and particularly cognitive behavior therapy, but more about that later. Additionally, I was also working in the personal development industry, so personal development and psychology together is quite a powerful tool in many ways. But as I said, more later. Now, I just want to mention a few things in relation to how this is going to work, and also particularly for the group. So everything we say here is confidential and will not be shared elsewhere. So what's said in the group stays in the group. Please understand that we're not medical doctors. So we can share experience relating to medications. And indeed, we have a member of our team who is a specialist in nursing and works a great deal with pain medication. So we can share some information about medications and treatments, but we can't give medical advice. That's not what we're about. Pain management is complex. Everybody who suffers from a chronic pain condition knows that. So here we're going to provide some simple solutions that, if they're implemented, it can effectively manage pain. This is a one-time masterclass, no cost, no fees, no catches. Our goal is to offer practical value and, for us, to assess our delivery. Are we any good at what we do? We would love to know. So your feedback is valued. We would ask for a brief and honest written testimonial. You can drop these in the group. Just tell us what you thought about this particular event. Simple, straight to the point. Don't mince your words. If any questions come up for you during this event, please drop them in the comments, and as soon as we're finished, we'll come into the group and we'll answer the questions. Okay, Leo, would you like to say anything more about confidentiality?
Well, it's absolutely confidential, and we are not using this information elsewhere. We just really trying to see how much impact we can make with our experience to help people globally, because that thing that we have an international team. We have people from Britain, from America, and from Russia, and that just shows how universal the problem of pain is. People are people everywhere, and pain is pain for everybody, and it doesn't have borders. That's just something I want to add.
Yeah, I love that way of explaining it, no borders. Whilst Leo's mentioned the team, I'll just give you a quick run through about the sort of people we have. So myself and Leo relate to psychology and personal development. We have a naturopath doctor who's based in near to Seattle in the US with a lot of experience working in pain management. We have a nurse specialist also with a lot of experience working in pain management. We have a physiotherapist, the same. We have two mental health professionals who work in all kinds of mental health areas, but both have a special interest in pain management. You will be able to meet all of these people within the group because they will be popping in and out at different times. So please, if you see them online, do talk to them. They're all friendly, they're all helpful, they will talk to you. What they won't be doing, though, is offering one-on-one sessions. That's something else, but they will be available to chat within the group. So let's just talk for a moment or two about breathing. I found that when I had a particularly bad pain day, my breathing was all over the place. It was terrible. Physiotherapists pointed it out on more than one occasion. I was breathing from the chest. The problem with breathing from the chest, as many adults do, I hasten to add, is that it can create stress, it can lead to headaches, it can lead to muscle tensions. It can create all kinds of problems that we don't need. We've got enough problems as it is with pain, so let's not add to it. So what sort of bit of breathing should we be looking for? Think for a moment about a baby. If you watch a baby breathe, you will notice that the first thing that happens on its in-breath is that its belly will rise. And when it exhales a breath, its chest will rise. So it's belly first, chest later, always in that beautiful way, that beautiful system. But as I said, most adults do it the wrong way around. So we kind of breathe in so quickly that our chest rises, our belly, the air doesn't reach our lungs correctly. And we don't expel the air that we breathed in as quickly as we need to be doing that. And the system gets confused. And as I said, it leads to stress. It can lead to headaches. It can even lead to insomnia, believe it or not. So what do we want to do? Well, we certainly don't want to increase our heart rate or blood pressure. So let's think about it like this. Let's try this very slowly. For 3 seconds, we'll breathe in through the nose, hold the breath for 3 seconds, and then push the breath out through the mouth. In through the nose, hold for 3, out through the mouth for 3. Now, if you find that 3 seconds isn't enough for you, then increase, go to 4, 5 seconds, whatever fits, whatever feels right for you. But we need to create this circuit. If you put your hand on your belly, when you breathe in through the nose, you should feel your belly rise. Mine does yours? If it doesn't, I suggest that this is something that's going to need some practice. So in through the nose, hold, out through the mouth. When you let the breath out through the mouth, make sure you're expelling all of that air in your lungs, because once it's been in the system, it's no good anyway. You need to get rid of it. Start again. Okay. Breathing that way puts much more air into your system. And through putting the air into your system, of course, you're getting more benefit from the oxygen you're taking in. Less likelihood of headaches, less likelihood of stress, less likelihood of raised blood pressure. Okay, there are a lot of things that contribute to raised blood pressure, but breathing is one of them. So worth bearing in mind. So remember, breathe like a baby. It's the way. Now, let's just step on a little bit from this simple breathing system. And what I'd like you to do is think about an area of your body that currently has pain. Okay, if you're pain-free at the moment, think about an area of your body that often has pain. And you might want to close your eyes for this. So get the breathing going, as I just taught you. And on the next in-breath, imagine that you're breathing in through the pain site. So I've got a pain site right here at the moment because I was bitten by a mosquito half an hour ago. So I'm going to imagine breathing in through the mosquito bite. So in through the nose. Hold the breath and breathe it out through your mouth, not back through the pain site. In through the pain site, hold the breath, out through the mouth. Practicing that has a remarkable effect. When I first learned this system, I discovered that I started to feel something in the pain area. I started to feel a sort of a sensation of a cool breath coming in through that place. And that was quite incredible. So please, I urge you, practice this. Practice it as many times as you possibly can during the day. It really is beneficial. Sounds a bit wacky, I know, but give it a go. Okay. Let's move on by asking Leo to talk about imagination and the value of using our imagination.
Well, yes, imagination in my practice and in my view is the most valuable thing that our brain uh, gives us, our psyche. And we are usually told that using your imagination or like imagining things, something not valuable, something underestimated, or even ostracized, that it's all in a head. I'm sure you've all heard that even concerning your sufferings and your pain, that it's all in your head, just sort it out. Nobody sees it. That's why we don't believe that you suffer. You might be pretending or something. And it's very offensive, and you feel like you're not trusted. But the newest science research shows that imagination is the place where your body and your psyche connect, because your psyche is based in your brain and in your nervous system. At the same time, your nervous system picks up what happens with your body. It's the nervous system that tells you that your pain is more severe, or maybe you're painless, pain-free for now. It's the nervous system that gives you signals. And if we just believe in the idea that we are able to heal ourselves, or to ease our pain, or to manage the pain somehow, accept medical uh, procedures, or along with medical procedures or medication, then we can do it through imagination. Like an easy exercise might be, we all know about pain scores. This is something that we know well, and that our physicians ask us, what's your pain score? And it's something always discussed within the community of pain sufferers. What's your pain score? This is my pain score. But this is a kind of deceitful thing, because pain is a very subjective issue. Pain is something you experience, and it's just some slight uh, possible example that you can bring out and tell your physicians, I am 3 today, or I am 7 today. But inside of you, it's not in numbers. It's something you experience, and that cannot be objective. So I propose to use your imagination in a special way. One thing is that uh, I propose you to close your eyes, and also think about some place in your body that's in pain now. But don't think of a number. Just imagine the color, and any color that comes first is probably right. A color that represents your pain now. At the same time, look at the shade of the color that you are imagining right now, that has come to you. Consider that this shade is somewhat close to the number you usually put to this intensity of your pain. If it's probably it will correlate. If the pain is strong, then the color is brighter or darker or more intense. If the pain is light, or probably you're just completely pain-free, that the color will be the lightest shade. And now remember the exercise with breathing through your pain. Imagining the color that is now in front of your inner sight. Just imagine that with the breathing in, you bring in some energy or lighter shade, light color, maybe white color or bright light. And while breathing through your pain, imagine that you add this lighter shade or white color or white light coming from somewhere outside through your breathing in. When you breathe out, you somehow move your pain and move the color and add some lighter shade to this color and make the color lighter, as if you are taking this color through the spectrum towards the lighter shades. And again, you breathe in and you're taking in some white color, light color, and while breathing out, you breathe through the pain, breathe through the color, and make it lighter. And now notice whether you are able to make the color lighter. And at the same time, check out your pain and notice whether you manage to make it slightly easier, less painful, maybe a bit loose, not that bad and concentrated, but maybe a bit easier. And consider it a success, because if you notice that you can make an impact on your pain, then you're becoming the master of your pain, the manager of your pain. And just a matter of practice, how farther you can go, and try to use these exercises as often as possible. What do you think, Steve?
I think that was very cool, actually. My mosquito bite started as a watery sunshine, so yellow, not quite yellow, not white, because it's no big deal. And when I finished that exercise, it was white. And I honestly feel that the mosquito bite isn't as bothersome as it was 10 minutes ago. It's cool. It worked.
Actually, it's for training exercises, it's better to take the easier conditions, maybe slight pains, because when you're in deep pain and in deep distress, such exercises seem to be very light and it's hard to move. So for training purposes, pick up some better days, because when you train on, like, when you train in the gym, it's probably then easier to train outside in the field, in the battle.
Perfect example. I was just thinking about pain scores, actually, and I've done this more than once, and it's probably not at all funny for a medical doctor to hear it. But the question, Steve, what's your pain score today? On a scale of 1 to 10, 1 being no big deal, 10 being quite severe. 15. And the look on the doctor's face when you would say something like 15 would be quite astounded. And the thing was, though, was that I meant it, because on those days the pain was black, very, very black. And I really didn't know what to do to take it away. And these tools that we've been talking about today are the perfect example of the way I found to leave the pain, to get away from the pain and to start to heal. It wasn't a 5-minute process. It took time, of course it did. But simple things like this make such a difference. So those 15s, okay, that kind of a little bit cheeky to say that perhaps, but really that's how I did feel like that. Okay, they wanted 1 to 10, I gave 15 because it felt so terrible. But it was to make the point. Thanks, Leo. That was really cool. Now, just a reminder, if you have any questions, drop them in the group and we will get to them as soon as possible. Now, I just want to mention some future things we'll be doing. We will be doing some specific topic masterclasses, a little bit like this, but very specific things. It might be with the physiotherapist, for example, or the pain nurse, and so on and so on. So they'll be very clear and very specific. If there is something specific that you would like us to cover, drop it in the comments and we'll get it into the list, because our aim is to serve. We really want to help. I know what it's like on the wrong side of the pain barrier, and I certainly don't want people to be sitting there if there are even the smallest things we can do to help. So please drop them in the comments. We will respond. Now, we also have one-on-one coaching available, again, with any member of the team. We have another system that we call two-on-one coaching that Leo and I have used. So the two of us would work together with one client. As you've heard from us already today, we come from slightly different standpoints. Therefore, we have different things to offer. Some people find that beneficial. It's not threatening. It does sound like two psychologists coming at me. That's going to be challenging, but it's not like that. We're nice guys, honestly. We're very caring and very careful. But it's something to think about. You will be seeing more information about this in the Facebook group. Additionally, there will be in the very near future a pain management program, or at least 2 levels of pain management program. One level may be for people who have been suffering from chronic pain for a very long time. And the other level will be people who have perhaps not been suffering for quite so long, and they're still working. So slightly different emphasis in these pain groups. Again, all the professionals we've mentioned earlier will be involved, not all together, of course. So, for example, week 1, maybe Leo running something relating to psychology. Week 2, maybe me, personal development, and a little bit of psychology. Week 3, physiotherapy, and so on. But you'll hear more about these in the group, so watch out for the info. Please ask if you have any questions. We would love to answer them for you. So, we hope this has been of some small value to you. Please let us know how you feel, as I said before. And don't hesitate to message any one of us if you have any questions, any thoughts, any ideas you think you might like to try. Let us know. The important thing to remember, and I've seen this in the fibromyalgia group a lot recently, the number of people who feel that they are crazy is phenomenal. And believe me, ladies and gentlemen, you are not crazy. That is not what it's about. That's easy to say, hard to take in, but it's absolutely true. Okay, Leo, anything to say in wrapping up?
There is another exercise I can propose, actually. Remember, I mentioned such a kind of scientific term, biopsychosocial approach. And this is not a new term and not a new idea, but it's something lacking in many approaches towards lots of things, including pain management. For example, physicians think their approach is good, like esoteric woo people think their approach is right, psychologists think that their approach is appropriate, but the truth is that the healing lies in the multidisciplinary or even interdisciplinary places, you know, because human nature is very complicated and at the same time is very simple when you remember where we are in the body. We have our higher psychical functions like psychological, and we have our environment and our surroundings, people and things around us. So if you notice the 2 main exercises we showed you today, we introduced to you, were first was physical body. It's breathing, natural thing that it is part of your body functioning is breathing. If you use it mindfully, it will bring change. Then we added some psychological thing like imagination. It's imagining some color and connected with connecting it with the body, with the pain, with something you want to heal. And now I want to introduce the kind of environmental thing, and the very often people with some conditions lack support, and even if you do have people around you who support you, very often we see that they don't understand us. They support it because they love us, and that's great, but sometimes there is a lack of understanding. We also know that our condition impacts their well-being, because we become very dependent on them and we don't like it. So working with the idea of people and human support around you is kind of complicated in the sense of such a live stream, you know, somewhere online. So I propose you some natural thing. It's nature. Nature is also part of our natural environment, and we are able to find it everywhere, even if we are in a downtown of a big city, you know. Because if you have like plants on your windowsill, it's already something associated with nature, part of it. A human personality and the human body is also a part of nature. And even if you're able to move, if you have backyard, if you have woods around you or parks nearby, and during lockdown, if you're allowed to go there and you're able to move there, that's cool. But another thing about imagination and about brain functioning is that sometimes imagined things are accepted by the brain as if they are real and as if you can touch them. So right now I want to bring you another exercise. Just close your eyes again and notice your breathing. Notice how the cool air touches your nostrils and passes into your head and down to the lungs and down to your belly, and how it becomes warmer when you breathe out. Just concentrate on these cycles of cool air that you breathe in and warmer air as you breathe it out. And now imagine yourself in some special safe place in nature. Something that just comes to your mind, in your inner sight. It may be a place you remember from earlier days that you've been before, or maybe it's just an imagined place. And picture yourself in this place and notice what you can see around you. Whether it's somewhere in the woods or in the fields or a backyard, someplace in nature. And try to imagine that you can hear the sounds of the nature. Maybe the birds, or maybe the mosquitoes. Maybe some slight sound of the wind in the grass or in the leaves. And try to imagine that you are standing barefoot on the ground. Try to make this sensation as real as possible. Standing barefoot and touching the earth and connecting to the earth is something very, very deeply natural for any human, even though we are so civilized now. You cannot move the caveman out of your subconscious mind. And imagine that you're breathing your pain or your discomfort down into the earth through your feet, through the soles of your feet. And that when breathing in, you're breathing in the earth power. Earth is our mother. We are part of earth. And so, as a good mother, The earth is eager to take our pains and to give us its strength. So when you breathe out, imagine that you are pushing your discomforts down to your mother, good mother that is ready to take your pain, take away your pain. And then when you breathe in, imagine that you are taking some nourishing strength coming from the earth. Remember, it's a very safe and sacred place to your soul. So try to pick up this notion, this sensation of safety and oneness with the place you're in. Pay attention to what you sense, to what you feel, and what emotions come to you when you picture yourself in this safe and sacred place somewhere out in the nature. Even if they're kind of sad, that's fine. Probably you're just missing it a lot. But it's very nourishing and very healing. It's your natural environment, and you can address to it to ask for help, ask for healing. Remember that you are free to imagine it anytime you want, and you are free to contact that sensation anytime you allow yourself. Just make allowance. Remember everything that you thought of or felt or sensed in your imagery, and thank the place. Thank yourself for using your time for your own purpose. And you may open your eyes. I'll be very happy if you share your experience, if share what you felt, and I think I will be very grateful. I'm really anxious to hear from you.
Thanks, Leo. I'm not going to comment on that except to say that it's wonderful, and I've been doing that for quite a long time now. And not long after I learned about this particular technique, the teacher said to me, no, somebody asked the teacher, is it possible to do that sitting in an airplane? And he said, yeah, of course it is. And you could see a few eyes around the group were unsure. I was kind of middle of the road, not sure either way, but I went with the flow. Now I can do that exercise whilst I'm riding my mountain bike through the forest. It's for real. You can do that. It's an incredible sensation. Just that whole idea of being connected. It's absolutely beautiful. But thanks, yeah, nice one. Okay, thank you, everybody. We'll see you all again soon, I hope. Take care and practice those exercises. They're worth it. Thanks, Leo.
Thank you, Steve.